This kind of feels like there's a lot of measles floating around right now, and there's been a lot of questions about who needs an extra dose or a bonus dose or a booster. When is it appropriate? Measles is contained in the MMR vaccine, the measles, mumps, rubella, which is given at 12 to 15 months and 4 to 6 years old. So most kids get it at 12 months, and most kids also get it at 4 years of age. Measles was declared eradicated from the United States around 2000, which means that there's not generally person-to-person spread, though there are occasional outbreaks generally in unvaccinated communities. However, around the world, measles is not eradicated. So it has always been a recommendation for babies that are 6 to 12 months who are going to be traveling internationally to consider getting a bonus MMR dose. They would still need one around 12 months and one around 4 years, but they would be getting an extra to protect them during that travel from measles. Second part of that recommendation is if you live in an area that has a local measles outbreak, it is something to consider to get that bonus dose between 6 and 12 months of age to help provide protection from that kid against measles. One dose is about 93% effective, 2 doses around 97%. That first dose doesn't hold as well in the infant period, which is why we generally give it 12 months and older. Every medical intervention on the planet comes with risks, and the MMR vaccine is no exception. Biggest risks: redness, swelling, pain at the injection site. You can have some joint pains, you can have some lymph node swelling, fever, headache, body aches, a little bit of a rash. Those are the most common. Potential risk of these more serious complications is less than 1 in 100,000. Things like allergic reaction like anaphylaxis. You can have something called Guillain-Barré, which is a weakness and sensory change that starts in the feet and moves up. Low platelets, that is temporary, and then febrile seizures. Generally, febrile seizures tend to run in families, but because you can develop a fever with the vaccine, there is a risk of febrile seizures. When you consider those risks are less than 1 in 100,000, and the risk of hospitalization if you do get measles is about 20%, the risks are vastly outweighed by the benefits of the vaccine. And the MMR vaccine does not cause autism. No vaccine causes autism. If you live in West Texas, it's probably reasonable to have a conversation with your pediatrician about this bonus dose. If you live in a state that doesn't have any cases, or maybe one case that's not close to you, I think it's reasonable to hold that conversation off a couple weeks and just see how things go. If you're a bit older, a little bit more seasoned with life, if you will, and you had 2 doses or you had measles as a child, you are likely protected. But if you have any questions, you can talk to your doctor about doing titers, or if you just want to go get another booster, you can. They're available at most pharmacies. But it is a live attenuated vaccine, so if you have a compromised immune system or something like that, definitely have a conversation with your doctor before you decide to do that.